The campaign to save a hospital's casualty unit reached the doorsteps of Downing Street today. Consultants and MPs supporting Lewisham's Accident and Emergency Department handed in letters and a petition with thousands of signatures. Plans are to close it as part of a reorganisation aimed at saving the South London Healthcare Trust after it went into administration. The details now from Piers Hopkirk.
Save Lewisham Hospital, save the NHS!
At the gates of Downing Street, a message for the Prime Minister today.
Save Lewisham Hospital, save the NHS!
The delegation was just 9 strong, but they carried with them the names of more than 32,000. That's the number of signatories opposing the potential closure of Lewisham Hospital's A&E department.
Undoubtedly, we have a really big fight on our hands to reverse these proposals. But with 32,186 people signing our petition in just 5 weeks, I think it's a very, very clear demonstration about the concern and the opposition that exists in Lewisham.
I would appeal to the government, the Secretary of State, to whose desk this will come in February, not to carry out these proposals. These proposals are rushed and hasty, and they do a grave disservice to the people of Lewisham.
Local GP Louise Irvin thinks the proposed closure is not just wrong, but potentially life-threatening.
Without wanting to scaremonger, I think there could be deaths due to delays in accessing care, not just because of delay in reaching the other hospitals, but because those other hospitals will be overloaded. The calculations are not accurate about the increased demand on other local hospitals if Lewisham closes. And therefore, I don't think the facilities will be in place to deal with the sick people that will be coming.
The closure is being proposed not because of problems here, but problems here, the neighbouring South London Healthcare Trust, which is facing crippling debts. Matthew Kershaw is the NHS troubleshooter who's compiling the proposals.
Are you just pushing through a predetermined solution here?
What we're doing is we've worked locally very closely with doctors, nurses, health professionals and other people in the public sector to come up with what we believe is a good set of recommendations to address a very significant problem. We've absolutely not prescribed the outcome. We're in a consultation and we need to listen to the views that people express, and then we need to reflect on those.
For those seeking to make their voices heard, time is running out. The Trust Special Administrator's report goes to the Secretary of State on January the 7th. He will then make a final decision around February the 1st. Piers Hopkirk, London Tonight, Lewisham.